headrest paper. Could somebody give a headrest paper to Cassandra, please? Thank you. Side posture is a very important technique, and you should do it incorporated in your treatment, as I said in my lectures. But there are some mistakes, a few mistakes over the years, 13 years of teaching, that I see students make. So I want to go over those before showing you the technique, so you don't make that mistake as well. Okay. First of all, whenever you do the technique, always stand here. Sometimes patients, especially overweight ones, they fall down, the table falls down. You never put a patient on the side and go have a coffee and email your friends, check the Facebook, never do any of those things. You must always stay here. My body protects this table, because tables can fall down. Be careful about that. Side posture is a little bit more dangerous. So you put the patient on the side, facing yourself, facing me, please. Come as close as possible. Leg is straight. Okay. The first mistake that I see students make, they don't bring the patient too close to the edge. They put the patient here, and then the knee is blocked by the table. If the knee is blocked by the table, you are just acting. You are not doing osteopathy, because there is no rotation. You try to rotate the knee, but the table stops it, and that is not the technique. So first, she has to come close to the edge. The bottom leg is straight. Okay, I see sometimes the bottom leg bent. If it's bent, you don't create a torque enough to do the job. So bottom leg is straight. This top one, she is straight because she's a landowner. No, I'm joking about that. Many people can be fit. But a lot of patients who are not, this leg is at this angle. It's not like her that she stay 90 degrees. Remember, none of you want to go to our after school geometry class. 90 degrees. Not here. This is not 90 degrees. If I see some of you doing this, I will send you to the geometry class. And I know who you are. So, to keep this in the 90 degree, I use my thigh. See, I can move the thigh, and I keep her in 90 degree. The foot behind the knee. Now, this is the most important part here I will show. That is, I see many people making mistake on YouTube. I watch videos, I see chiropractors make this mistake often. And this is shocking. You have to create a torque in the spine and then stabilize it. Imagine if you have a wet towel or wet t-shirt and you want to take the water out. You keep one part, and with this squeeze and turn until water goes. If you don't keep this secure and this just moves, you're not going to take out the water. This has to be stabilized. But I see this is loose. So when you take the lift the shoulder to create a torque, here I see people just then do the treatment. No, you have to push and keep it like this. Hold it there. This has to be stabilized. If you just, I see some so lightly touch it, patient can move, then that is not really the stabilization that you look for. Well, you decided to show off. What happened to you yesterday?
Oh, I had a headache.
Okay, good. So, keep this. This is the main thing. Now, I'm talking, but in treatment, if you remove your hand, you have to do the whole thing again. Okay? So, And now because I want to explain to you, but in treatment, when you do this and push this down, then you have to keep it. If my hands removed, her position might get destabilized. I have to do everything again. So after this is another mistake the students make. Remember I told you, forearm parallel to the table, fingers up. For this, I have to go over patient. If I stay here, it's impossible for me to do it. A lot of people don't want to do it, to bend so much, and they end up doing the treatment like this. Then you cannot put posterior to anterior force, P2A force. For that, you have to bend over. So this is a little bit tricky. Put this, find a spinous process, find the TVP. You see, you take a skin slack, then you take the skin tension out, and now my forearm is parallel to the table. You see, it's not like this. A lot of people do like this, but that is wrong. That's not really P2A pressure. Like this, and then P2A, and hold 2 to 5 seconds. Remember, 5 seconds if you want to make the patient comfy, more relaxed. 2 seconds if you want patient to become more active. But most people these days look for relaxation, so it's better to keep longer. Unless if you work for a sport team, you have people who right after this going to play tennis, football, and they want to be active, then keep 2 seconds. But the rest, you do relax from L5 to L1, then back to L5. Very relaxed and gentle. This is without knee assist. With knee assist, you use your knee to rotate the patient. Okay, it's not just putting your knee on the patient. I see students just put the knee like this and then they do the treatment. This is not the treatment. Imagine I'm not doing the treatment. You see the movement now just with my knee. You see? I'm rotating here. This movement you have to do. This in combination with P2A. Okay? So to show you knee assist, again, take it, shoulder, find the spinous process, put your knee on the knee, and go, hold 5 seconds, relax, 1 level higher, take your skin slack, take the pressure, put, next one, take your skin slack, a little pressure to take the skin tension out, and P2. Okay, these are the common mistakes students do when they do this technique. It's a very effective, important technique, so you have to get it right. Make sure the rotation is down. Rotation of this is the pelvis very important. Stabilizing the shoulder, very important. These things have to be done at the same time, and then P2A. All of these have to be, but if you can't get it right, you can, as I told you, learn step by step. You can just do this until you know how to get the rotation. You can do this just by itself until you make sure you know how to stabilize the patient. A lot of people just put the hands here. Remember, putting the hands here is not stabilizing. This is what the students do. But if you look at now, she can go more down. She go more down. That little going down, this little is the difference between stabilizing the patient or just faking it and doing a show and acting. That is just acting. If you just put your hands here, without pressing down. This has to be locked. Shoulder has to be locked. Okay? So once again, 90-degree lock, rotation, fingers up toward your chin, elbow parallel to the table. You do all this together, you will do beautiful technique, amazing technique that people will enjoy. Okay? So, Dr. Khorrami will show the other techniques. I just wanted to go over this with you because it's very important and I wanted you to know the common mistakes. Okay, Dr. Khorrami?